Hello, I am Dr. Johnson. It is my pleasure to be here today and talk about common support drugs. Prednisolone, amitriptyline, laxatives and haloperidol are chosen to introduce today. Hopefully the lecture with me today will provide some useful information for your study. Prednisolone can cause you side effects such as weight gain, restless, mood changes, muscle pain, sweat, weakness and sleeping problems. You may feel very thirsty and hungry. Make sure the doctor knows your other internal problems such as heart failure, high blood pressure, diabetes, stomach ulcer. Those who are trying to have a baby, or breastfeeding mothers cannot take this medication. To cope up with that side effect you need to eat healthy food for maintaining good health. Physical exercise is very important for maintaining weight. Use lightweight cloths to feel comfortable. To avoid sweat. Remember to take the medication in the morning so that you do not feel restless at night. Amitriptyline is used in the treatment of depression, migraine, chronic tension headaches, and neuropathic pains in adults. In some cases, the medicine is prescribed to treat nocturnal enuresis in children over 6 years old with doctor consultation. The medicine is recommended to be given in the evening. It is also important to monitor if the dose is over 100 mg daily. The dosages should be increased gradually. Medicine is taken 1:1, 2 hours before bedtime. EKG is needed to rule out heart issues. In case of pregnancy, breastfeeding, or planning to have a baby, the patient should consult with a doctor. Besides, alcohol is not allowed during the treatment with amitriptyline. Driving or hazardous activity are banned if a person takes amitriptyline. Risks to get sunburn is higher during amitriptyline treatment. Therefore it is important to avoid sunlight tanning beds. Remember to seek emergency help with signs of an allergic reaction such as dyspnea, swollen face, lips, throat. Laxoberon is used for the short-term treatment of severe constipation. The medicine is in form of capsule or drops. 1 capsule of laxoberon contains 2.593 mg of sodium picosulfate monohydrate equivalent to 2.5 mg of sodium picosulfate. Meanwhile 1 ml solution of laxoberon contains 7.5 mg sodium picosulfate. Laxoberon capsules should only be used continuously as prescribed by the doctor. The capsules should be taken with a sufficient amount of liquid. For prolonged use, the medicine is taken only every other day. Laxoberon in form of capsules might cause several side effects such as ileus, intestinal obstruction, acute inflammatory bowel disease, and severe acute conditions with abdominal pain. There are risks for serve dehydration and hypersensitivity to sodium picosulfate or other expedients which are caused by laxoberon in form of capsule. Hypersensitivity to sodium picosulfate or to any of the excipients. Haloperidol is used to treat positive symptoms of schizophrenia, such as hallucinations and delusions. Haloperidol is also effective for children with excessive motor activity, which are indicated in different symptoms. For example, impulsivity, difficulty in sustaining attention, aggressivity, and poor frustration tolerance. Besides the side effects listed in the slide, there are certain warnings about haloperidol that we should take consideration. Firstly, haloperidol may cause a severe reaction called a neuroleptic malignant syndrome. This occurs due to haloperidol's interference with dopamine. Secondly, haloperidol may trigger extrapyramidal symptoms. These include involuntary movements, such as hand tremors and shaking, stiff and slow movements, agitation or restlessness, and muscle spasms.
Thank you Dr. Johansson for the presentation. Thank you all.